Good day, everyone. Welcome, and thank you for joining this medical briefing. My name is Lieutenant Colonel Carlo Rossi, and I'm the Senior Medical Officer for Canadian Armed Forces members and families, no matter where you're posted to in the United States. I'm part of a team of 5 professionals that are based out of the Washington, D.C. Embassy and are responsible for your healthcare, no matter which chains of command either you or your family members may report to. Let me take a moment to introduce the other members of the medical team. Lieutenant Commander Daniel Milner is a family doctor, and he's responsible for the day-to-day medical care coordination and concerns. Captain Sean Goodfellow is a healthcare administrator tasked with navigating the complicated medical finance realities of getting medical care in the United States. Master Sailor Lachlan MacDonald is a medical technician responsible for assisting with complex medical administrative cases. And Madame Sylvie Laliberté is our administrative and executive assistant. We have a 6th position for a medical records clerk. It's currently vacant, but hopefully will be filled shortly. Of course, all of us have families, and many of us have children who've accompanied us into the United States. We understand that it can be complicated to navigate the U.S. healthcare system. Today's presentation is going to cover critical information that I'm sure you'll require throughout your LCAN posting. The information will be available online, including all of our speaking notes, and you can review it as needed. The goal for today is to review how healthcare works for CAF family members, sometimes called dependents, here in the United States. Specifically, we're going to explain the Public Service Healthcare Plan and Allianz Global. We'll introduce TRICARE and how to make it best work for you. And finally, we'll review how dental care should work in the United States. If you're like me and prefer to learn by example, we will be working through 3 concrete medical scenarios in this presentation. Most importantly, though, if you forget everything else that we're going to tell you today, please remember that family members and CAF members can always email the medical team directly for any issues you encounter with healthcare. Before I hand it over to the rest of the medical team, let's take a sneak peek at clinical scenario number 1. This is the case of a 12-year-old child of a CAF member who falls while skateboarding after her regular clinic is closed, and her parents worry that she may have broken her ankle. She most certainly needs a medical assessment, some imaging like an x-ray, probably some medications, a cast, maybe some crutches. So if you're unsure how you would access a civilian emergency department after hours, or how to arrange for dual insurance billing with Allianz or TRICARE, if you've never seen an explanation of benefits, or you're not sure how you would deal with refused claims, or what your options are when it comes to prescriptions or procuring medical equipment like crutches, then stay tuned. You are in the right place. We're going to cover all of these points and many more in today's talk. That's it for me for now. I'll talk to you again at the end of the presentation. Thank you for your attention.
In this module of Knowing Your U.S. Healthcare for Canadian Armed Forces Families, you will learn about the Public Service Healthcare Plan. While posted in the United States, dependents of Canadian Armed Forces members use the Public Service Healthcare Plan as their primary health insurer. This differs from how family members paid for care in Canada. In Canada, primary, comprehensive, or basic insurance is provided by the province. Any supplementary or extra needs are claimed through the Public Service Healthcare Plan as supplementary insurance. In Canada, this supplementary insurance, provided by the Public Service Healthcare Plan, was administered by Sun Life, where families normally claim things like prescriptions, massage, or supplies for diabetes testings. In the United States, instead of the province being responsible for your comprehensive insurance, it is now provided by the Public Service Healthcare Plan and is administered by Allianz Global Assistance. In this slide, you will learn how to access the Sun Life website in order to update your information. It is important to note the Public Service Healthcare Plan will convert from US dollars to Canadian funds when reimbursing you. If claims are paid directly to the US health provider, funds will be paid in US dollars. This will be further explained in the How to Claim module. Once all information is updated, please call Sun Life at 1-888-757-7427 to confirm you've been switched from supplementary to comprehensive coverage. This can sometimes take a month to 6 weeks for the administration to catch up. Be assured your family is covered as soon as you cross the border. If after a month you are still not switched to comprehensive coverage, please contact your orderly room. To update your information with Sun Life, it's best to do it at their online portal at www.sunlife.ca/public service healthcare plan. Here you'll be able to log in using your Access ID. You may have to find it if you forgot it or don't know it or have never logged in before. Once you're able to log in, you'll be able to review your personal information, your contact information, and your preferences. But most importantly, you should go down to the bottom of the screen at Positive Enrollment, where you'll be able to update your address, update, if required, your direct deposit information, and add any new dependents if required. In this slide, you will learn how to navigate the Public Service Healthcare Plan's website. This is where you will learn your entitlements to best plan how to access care. In order to best understand the Public Service Healthcare Plan, it's best to go to their website at pshcp.ca. Here you'll find everything you need to know about the Public Service Healthcare Plan. Key to note are forms and documents, other useful sites, and frequently asked questions. Frequently asked questions are useful because if you have a question, odds are someone else has had the same question in the past. Other useful sites will bring you to research as well as the provincial and territorial health insurance plans. This might be important for you to know when you're returning to Canada to know exactly what's covered in each province and where you're likely to be posted. Forms and documents are also important, where you'll find claims forms, but more importantly, you'll find the plan directive. At the plan directive, you'll find everything that's covered and at what rate. You'll find information about the supplementary and comprehensive plan, how to make claims, what deductibles and co-payments are, other extended health provisions, and very importantly, you'll find the summary of maximum eligible expenses. If you go to the summary of maximum eligible expenses, this is information you would have probably used in Canada to find out what certain supplementary benefits are covered. You're still entitled to these down here, but you'll find at what rate, so you won't be surprised when the full amount isn't covered by your insurer. For example, chiropractors are covered up to $500 in a calendar year at a reimbursement rate of 80% with a deductible. This concludes the module Knowing Your U.S. Healthcare for Canadian Armed Forces Families, the Public Service Healthcare Plan. In this module of Knowing Your U.S. Healthcare for Canadian Armed Forces Families, you will learn about coordination of benefits. Much like in making a claim for dental coverage in Canada, the coordination of benefits for medical care here in the United States is important. To put things into terms we're used to, I like to compare this to paying for dental care in Canada, since we're used to actually seeing dental bills. In Canada, both spouses will often have dental insurance. There are rules to coordinate which insurance company pays first, which pays second, and how much is left over for us. As a simple example, if a family member had a $100 procedure, which was fully eligible at 90% coverage, the primary insurance would pay $90, the secondary insurance would pay $9, the remaining $10, and you would pay the remaining $1. Medical insurance in the United States works very similarly. The coordination of which insurance pays first and which pays last is very important. By law in the United States, TRICARE must pay last. With this in mind, the claiming process for medical care must be claimed in a similar fashion. Now, we aren't supposed to have any out-of-pocket expenses for most medical expenses in Canada. So there's an extra step. As a simple example, if a family member had a $1,000 procedure, which was fully eligible but would normally cost $300 in Ontario, you could claim, first, through the Public Service Healthcare Plan, which would pay 3 times the Ontario rate, providing you an explanation of benefits, reimbursing you $900, and rejecting $100 under the code R70. Second, you could claim through TRICARE, which would pay the remaining amount less a copay. In this example, let's use a copay of $33 for an in-network specialty visit, which is a fee you are charged each time you access care. TRICARE would provide you an explanation of benefits, reimbursing you $67 of the remaining $100 and leaving you with the copay. Finally, under the Foreign Service Directives, you can claim your out-of-pocket expenses up to the R70 amount. In this case, you could claim your $33 copay, as it is less than your R70 amount of $100. The important thing to remember is that you have options, and the coordination of benefits or billing order is important. This concludes this module of Knowing Your U.S. Healthcare for Canadian Armed Forces Families, Coordination of Benefits. In this module of Knowing Your U.S. Healthcare for Canadian Armed Forces Families, you will learn about billing procedure. In this module, you will learn the complete process for claiming healthcare costs through multiple insurers. You always want to claim first through the Public Service Healthcare Plan and second through TRICARE. Ideally, you also want to have those providers direct bill in that order if possible. Knowing who to claim your medical costs with and in which order is key. Knowing how to do that would also be nice. In Canada, you would present your provincial health insurance card and leave everything else to the number crunchers. People living in the US have a much better understanding of what their healthcare costs each time they receive it, because they either see a bill or at least an explanation of benefits from their insurer or insurers. The most simple solution for Canadian Armed Forces families is to have the healthcare provider bill the insurance companies directly. Important information here is if you normally access your care at the military treatment facility, you may receive a referral for TRICARE off base. Remind your civilian provider that Allianz must be billed first. The first step to ensure the insurance companies are billed in the correct order is to complete an Other Health Insurance or OHI form and submit it to your military treatment facility. These forms are available at tricare.mil for West and East regions, or at your military treatment facility. To know if you belong to TRICARE West, HealthNet, or TRICARE East, Humana, you can refer to this map or go to tricare.mil. Submitting your Other Health Insurance form at your military treatment facility is always prudent, but completing this information online is a good way to ensure it's properly documented. MilConnect is another great resource as it allows you to enter your OHI information yourself. It also gives you access to your TRICARE Online info in order to renew prescriptions, access your personal health records, and also has other capabilities. Once you have registered your other health insurance information with the U.S. Department of Defense, you can be reasonably certain they can coordinate your benefits in the correct billing order. That said, it is always prudent to reconfirm this with outside providers directly, each time you see them, and especially the first time you deal with them. Since you will always try to direct bill, here's information the service provider is likely to need. If you ever have difficulty arranging direct billing, this can often be corrected by calling Allianz and asking them to call the billing office of your provider or handing over your phone once you're on the line with Allianz. To do this, call Allianz at 1-800-363-1835, then select option 1 for English, option 2 for the expatriate plan, option 1 for public service plan, and option 3 for a predetermination. If it proves impossible to direct bill your primary insurer Allianz, you will need to pay up front and then claim for reimbursement. This short video will guide you to the claim form. Once you have the claim form, you will know what documentation you need to provide Allianz. Note, the claim form indicates Waterloo, Ontario as an address to mail it to. You can also mail your form to the Richmond, Virginia address shown earlier. In order to get the most up-to-date claims form for the Public Service Healthcare Plan, you must first go to the Public Service Healthcare Plan website at pshcp.ca, where you'll find the claims heading and how to submit a claim. Now if you scroll down, you'll find how to submit a paper claim, and we're interested in comprehensive coverage. Click the link for the out-of-country claim form. And you'll have the most up-to-date claims form. In order to have Allianz process your paper claim as quickly as possible, we've been advised to follow this procedure. This way Allianz gets the required info quickly, electronically, and then receives original paper documentation to confirm. Whether direct billing or paying up front, you will receive an explanation of benefits indicating what you've been reimbursed and what was excluded as an R70 amount because it was much more expensive than in Ontario. This is explained in the Coordination of Benefits module. This completes the step to claim with your primary insurer. If you're posted to a U.S. Department of Defense site and have been provided a DoD ID, you can use your DoD benefits number to direct bill to TRICARE as your secondary insurer. You can always ask local families which providers with which they've had luck direct billing to TRICARE. Alternatively, you can use TRICARE's website to search for yourself. This video will guide you in this search. TRICARE has a network of providers who have agreed to direct bill TRICARE at negotiated rates. This does not limit you to using a network provider, but if you find a provider you like in their network, it can save you from paying and then claiming manually. In order to find a TRICARE network provider, you will start at tricare.mil and the Find a Doctor link, which will bring you to their Find a Doctor wizard. Click on Network Provider. Pick a zip code. Here I'm picking one in Anchorage, Alaska. And pick TRICARE Select as your plan. And you will find a network provider. It has directed me to TRICARE West, since I'm in Alaska. Here I'll be able to select exactly what I'm looking for. So again, I'll put in my Anchorage, Alaska zip code and TRICARE Select. I don't want to drive too far, so I'll pick a provider that's 20 miles away or fewer. I'm looking for my wife and family to find a family doctor's office, so I'll search in family medicine. My wife and kids prefer a female doctor if possible, and one that's accepting new patients. I'll be directed to realize that TRICARE might not be up to date, and you should confirm with the doctor's office if they're actually truly accepting patients. And here I've been provided with the list of offices that are accepting patients that fit my criteria. This is not necessarily a recommendation that this is the doctor's office that you'd want to go with. However, it's a good place to start, and then you can decide what's the best fit for your family from there. This search tool can be used for a number of specialists as well, and will start you off so you can claim what's best for your family. If you opt for a provider that cannot or will not direct bill TRICARE, you can pay up front and then claim reimbursement from TRICARE directly. This video will guide you to the forms and addresses you will need. In order to get the most up-to-date TRICARE claim form, you'll have to go to tricare.mil. Go to Forms and Claims and Filing Claims. Where you'll find the contact information for either the East or West region, and if you're unsure, you can look at the list of states for each, and you can scroll down and download the claim form, and you'll have the most up-to-date form. You can now submit your claim directly to TRICARE the same way as you did when submitting to Allianz, with the additional step of including your explanation of benefits from your primary insurer, Allianz. Whether direct billing or paying up front, you will receive an explanation of benefits indicating what you've been reimbursed and what was excluded as a deductible, copay, or above an eligible amount. This completes the step to claim with your secondary insurer. If after you've claimed through the Public Service Healthcare Plan, Allianz, and through TRICARE, you still have some out-of-pocket expenses, you can claim those out-of-pocket costs up to the R70 amount listed on your Allianz explanation of benefits through your medical team's office. In order to do so, you will need to submit the following information: your explanation of benefits from Allianz, your explanation of benefits from TRICARE, proof of payment for what you were actually out of pocket, and a general allowance claim. This concludes this module of Knowing Your U.S. Healthcare for Canadian Armed Forces Families Billing Procedures.
Hello, in this lecture I'm going to introduce you to TRICARE. While posted in the United States, most Canadian Armed Forces members and the families accompanying them have their healthcare covered in part by the American government. The level of coverage in which you receive is determined by the jurisdiction laid out in the Reciprocal Healthcare Agreement between Canada and the United States. If you have a Common Access Card or a Defense Enrollment Eligibility Reporting Systems Card, DEERS Card, or Dependent ID, you are covered by TRICARE for the majority of outpatient healthcare expenses. In addition to outpatient care, if you live in California, Georgia, Hawaii, Maryland, North Carolina, Texas, Virginia, Washington State, or Washington, D.C., you are entitled to the cost of inpatient care as well. At this point, you might be wondering, what is TRICARE? TRICARE is the healthcare administrator for the Department of Defense in the United States, and they have multiple levels of coverage. The four that apply to Canadian Forces members or their families are direct care, which is the coverage you receive on base, where as a member or a dependent, you are completely covered for your care and medications received at the military treatment facility. TRICARE Prime, which is for the Canadian Armed Forces member to use when they are receiving care off base. TRICARE Select, which is the coverage for the Canadian Armed Forces families. This care is used in conjunction with the Public Service Healthcare Plan to better cover you for off-base medical expenses. This care can still come with copay amounts. There is more information available on our How to Claim section. TRICARE Prime Remote. If you are posted to the Rome, New York area, you will be covered under TRICARE Prime Remote so that you can access care on the economy where a sufficient military treatment facility does not coexist. The great thing about being a military family member in the U.S. is that in most cases, you can access your care on base at the military treatment facility. The base hospitals are a great resource as the care is top-notch and completely free. However, if you do not want to access your care in this fashion, you can get your care on the economy and claim through the Public Service Healthcare Plan and then through TRICARE Select as a secondary insurer. There is more information on this process in our How to Claim module. In this module, I'm going to cover how to register in the U.S. system, and I'm going to give you some tools to help navigate that system. Once the Canadian Armed Forces member has been approved for a Common Access Card, the Canadian Armed Forces member will have to make an appointment with the ID Control Center on base for their entire family. During this appointment, you'll be enrolled into the Defense Enrollment Eligibility Registration System, which will initiate your coverage in TRICARE. By the end of the appointment, the member will receive a Common Access Card. With the Common Access Card, you will need a 6 to 8 digit PIN, in which I recommend making this your service number minus the leading letter. The family members will receive a Defense Enrollment Eligibility Registration System ID card. The family and member will be issued one sponsor social number. Write this number down and keep it electronically as well. It is essential for making and checking into appointments. Now that we have covered getting you enrolled, you should also have a reminder as to the types of care previously discussed in the TRICARE brief. Here in the U.S., Canadian Armed Forces family members are often eligible to receive care on base at military treatment facilities. Doing so comes with many advantages like world-class care and reduced administration, as all medical and pharmaceutical costs on base are covered through direct care, and therefore you will not receive a bill and you will not need to file any claims. If getting your care on base is not your preference, as a Canadian Armed Forces family member, you are still eligible for TRICARE Select as your insurance for care on the economy. This insurance from TRICARE is given to dependents as a secondary insurer which can be used in conjunction with the Public Service Healthcare Plan. As it is a secondary insurer, please make sure that once you receive your identification card that you go to patient administration at your military treatment facility to complete an OHI form, which stands for Other Health Insurance. On this form, you will put down your Allianz Global Assistance information. For making claims through TRICARE, please select our How to Claim module.
I do have a quick video that shows you all the information needed to file your claim to TRICARE. First, we'll go to tricare.mil and then hover over the Forms and Claims drop-down tab in the top right and select Filing Claims. Then on the left-hand side of the screen, select the type of medical claim you would like to file. Here we'll select Medical Claims. We can pull up the claim form by selecting Patient's Request for Medical Payment, DD Form 2642. And below you can follow the link to the claims address. Please note that there are two different regions to submit your claim. There is TRICARE East and TRICARE West. On the left-hand side, under Medical Claims, there is a link for a step-by-step guide to filling out the claim form labeled Completing the Claim Form. In this video, we will show you how to find your Benefits Coordinator and Administration Counselor. This person is often referred to as the BCAC and can help you with any benefits questions or billing problems you may have. First, we'll go to tricare.mil, then in the search bar on the top right, we will type in BCAC and hit search. Next, we'll select the Customer Service directory. Then search your base by keyword. In this example, I have chosen MacDill Air Force Base in Tampa, Florida. This will bring you to a page with phone numbers and office hours for counselors responsible for your area. In this video, I will show you how to check some of the expenses you may receive while using TRICARE Select. Remember that TRICARE is a secondary insurer and some of these expenses may be reimbursable through the Canadian Armed Forces up to the amount of the R70 code provided by the Public Service Healthcare Plan. This process is described in our How to Claim module. First, we'll open the browser and go to tricare.mil. Then hover over Plans and Eligibility on the drop-down menu and select Health Plans. Select TRICARE Select on the left-hand side. On the next page, we will scroll down and click View TRICARE Select Costs. Then, under your plan, select TRICARE Select, and sponsor status is Active Duty, and select Group A. Here you can scroll down and see the co-payments and cost shares that you may receive under TRICARE Select. In this video, I'm going to teach you how to find a provider in your area based on your location and coverage level. So here we have the browser open to tricare.mil. I will go to and select the Find a Doctor option in the menu bar on the top of the screen. First we'll try Find a Network Provider. And let's say you live in Rome, New York. So we will put in the Rome, New York zip code and hit enter. In Rome, you'll be under TRICARE Prime Remote, so let's select that for our plan and hit Next. Then scroll down to find a network provider. In this, we are searching for a general location, but you can search by name or specialty if needed. Under location, we will again type in our zip for Rome, New York, and hit the search button. Here, you can see all the network providers in your area. Now, if you're not in Rome, New York, you'll be on TRICARE Select. So let's go through that using Colorado Springs. So let's change our zip to Colorado Springs zip code and hit enter. Then choose TRICARE Select and finally select Find a Network Provider. You will notice this is a different screen than before. That's because TRICARE West is administered by HealthNet, while the previous TRICARE East is administered by Humana. Again, we will enter our Colorado zip code and select our plan as TRICARE Select. Scroll down to Search Now and click. On the next page, you will find your network providers and local military clinics. Finally, what if you're not in an area that has network providers? Well, under the public tools, we will search non-network provider, and on the next screen, select non-network provider directory. For this, we will use Anchorage, Alaska for our search. So let's enter the zip code for Anchorage, Alaska and select Search Now. You can see a list of links to find out more about available non-network providers. You can still get coverage at these places, but they will not direct bill TRICARE. However, they may still direct bill the Public Service Healthcare Plan. In this module, I'm going to recap some of the intricacies of TRICARE and direct billing. TRICARE is a secondary insurer that is provided to Canadian Armed Forces families while posted to United States military bases. It is a secondary insurer, which means you must claim through the Public Service Healthcare Plan first and then go through TRICARE if you are receiving care at a civilian institution. There is more information on this process on our Coordination of Benefits module. Once you have received your Common Access Card and Defense Enrollment Eligibility Registration System identification, please make your way to the Military Treatment Facility, Patient Administration Office, and complete the Other Health Insurance form, which they may refer to as the OHI. You will complete this document using your client information from your Public Service Healthcare Plan. In this video, we will show you how to find your Benefits Coordinator and Administration Counselor. This person is often referred to as the BCAC and can help you with any benefits questions or billing problems you may have. First, we'll go to tricare.mil, then in the search bar on the top right, we will type in BCAC and hit search. Next, we'll select the Customer Service directory. Then search your base by keyword. In this example, I have chosen MacDill Air Force Base in Tampa, Florida. This will bring you to a page with phone numbers and office hours for counselors responsible for your area. In this video, I will show you how to find your referral manager. A referral manager can assist as a part of a team with your BCAC in order to administer your billing for care at military and civilian facilities. They can also assist in referring you to a civilian provider that is convenient for you. Here, we'll open our browser to tricare.mil and click on Find a Doctor. Then we will select a military hospital or clinic and click Next. Then we will type in our base and hit search. For this example, I'm using Tinker Air Force Base. Then we will click on the hyperlink to get more information about the facility. Next, we'll click on the Facility Website tab. Next, we'll hover over the Health Services drop-down tab and scroll to the bottom to select Case Management. Other options do exist depending on your base. Like in Lewis McChord, you will go to the Patient Advocacy tab. At MacDill Air Force Base, you can use the Referral Management Center, and at Walter Reed, you would use the Patient Administration Department. I do have a quick video that shows you all the information needed to file your claim to TRICARE. First, we'll go to tricare.mil, and then hover over the Forms and Claims drop-down tab in the top right and select Filing Claims. Then on the left-hand side of the screen, select the type of medical claim you would like to file. Here we'll select Medical Claims. We can pull up the claim form by selecting Patient's Request for Medical Payment, DD Form 2642. And below you can follow the link to the claims address. Please note that there are two different regions to submit your claim. There is TRICARE East and TRICARE West. On the left-hand side, under Medical Claims, there is a link for a step-by-step guide to filling out the claim form labeled Completing the Claim Form.
In this module of Knowing Your U.S. Healthcare for Canadian Armed Forces Families, you will learn about finding and paying for dental care. Fortunately, not too much has changed for paying for dental care while here living in the United States. We are used to paying for dental care back home and claiming through Canada Life, previously known as Great West Life. This module will guide you to finding the plan guide, finding a dentist, navigating the Canada Life website and filing a claim, coordinating a claim that has medical and dental components, and claiming extra costs you'll see. As with the Public Service Healthcare Plan, it's always prudent to know what your plan covers when planning your family's dental care. The best source for this information is the Canadian Forces Dependents Dental Care Plan itself. This video will show you how to get to the plan and some key info available there. The easiest way to get to the Canadian Forces Dependents Dental Care Plan is to do a search under that name. The first link you have should bring you to the government site, where you'll get an HTML version of the plan, or you can download the PDF version. Key information to look for are benefits, as well as eligible expenses and exclusions and limitations. If we go to benefits, you can see what should be covered at 90%, 50%, annual limits for most services, as well as lifetime limits for orthodontic services. You'll get information on your annual deductible, your copay amounts, information for those of us serving outside of Canada, predeterminations of benefits, and if we go down to Annex B, we'll see services covered. Key information here under X-rays is there are types of X-rays that are only covered once every 3 years. This is important because when you switch dentists, often they will want full X-rays done as a new patient. Certain X-rays are only covered every 3 years. Some are covered more often. A way to get around this is to request from your dentist office where you're coming from to transfer a copy of your dental records to either yourself or your new dentist. There may be an admin fee for this, but it's likely cheaper than whole new X-rays before your 3-year limit. Family members can't access dental care on base, so eventually you'll need to find a dentist or dentists for your family. There are limits to what insurance through Canada Life will reasonably cover, so it pays to shop around. Even if the full amount charged is considered eligible, your 10% or 50% portion can vary significantly with different providers. The following video will guide you through a few options in your search for the dentist that's right for your family. When you move down to the United States and you're ready to search for a new dentist for your family, you have a couple different options. Of course, one option is to talk to fellow Canadian Armed Forces families and ask them which dentist they use, or ask your neighbor. And even though we don't have TRICARE coverage for dental for our families, they still have the Find a Doctor tool at TRICARE.mil. You can use their wizard and search for a network provider through TRICARE, and it might help you search for one that's appropriate for you. Here I've entered a zip code for Bethesda, Maryland, which is close to Washington, D.C. And I'll choose the TRICARE dental program for the plan. Again, we don't have access to this plan, but we can use their search tool. Another window will pop up. Again, I can search by my zip code for Bethesda, Maryland. I can search for pediatric if I'm looking for a dentist for my child, or I can use many other specialties. I can limit my search to 15 miles. And I'll get a list of pediatric dentists that are accepting patients. Again, this is no recommendation necessarily that this will be the right dentist for you, but it's a good start for searching. Another find tool is at findadentist.ada.org. I can type in my zip code again, pick a specialty, and I'll get a list of dentists that fit my criteria. Finally, if all else fails, you can always use a Google search on maps.google.com and do a search near your zip code. The advantage of this is you'll get other Google ratings that come along with it and see them exactly where they are on the map. And hopefully using one of these tools, you'll find the right dentist for your family. In this video, you will learn how to get to the Canada Life website and how to file a claim. To best use your Canada Life dental insurance, it's best to use their website at www.canadalife.com. Click Sign In, and the Group Net for Plan Members sign in option. You may have to register if you haven't been here before, but it is definitely worthwhile. Log in. You will notice that they used to be called Great West Life, and many of their website and forums may still reflect that. Not to worry, Canada Life is the proper place to go. Here, you'll get to your splash page where you have many options. You'll be able to check your coverage and balance remaining for the year. You'll be able to make a claim, look at your history, get your forms and benefits card number, and multiple update your profile, checking account, things like that. Here I want to show you make a claim. Here in the US, we're not allowed to do the online claim. If you scroll down, you'll see paper claims need to be used for out of country. Even with that said, they've updated their policy, and claims that used to be submitted by mail, where you'd have to mail it to Winnipeg, can now be submitted on their website. So you'd be able to find their claim form, download the PDF, and you'll have their most up-to-date form with everything you need to file. Instructions here, how to fill it out, get the copies of the relevant information, select out of country, and select your plan. You'll also notice there's options for an estimate to get a predetermination if you're looking for something expensive. Again, out of country, select our dental plan, 55777, where you'll be able to get all the documents you need, scan them, add them here, and submit online, even though it is a paper claim. There are times, usually with dental surgeries, where medical and dental coverage will overlap. In these cases, you will likely need to claim through the Public Service Healthcare Plan first, after which you may be able to claim some of your medical expenses through TRICARE, which is explained in the How to Claim module. Finally, you can claim through Canada Life. Up to this point, you have found the Canadian Forces Dependents Dental Plan to know your coverage, found a dentist, logged into the Canada Life website and submitted your paper claim online, and learned the order to make claims when there are both medical and dental expenses. Once your claim has been processed, you will receive an explanation of benefits similar to any medical claim. This is the same as any claim you would have filed for dental expenses in Canada. In this example, you can see $307 US was claimed for dental services for Evan and Rowan. A dental exam costing $78 for Rowan was denied because complete exams are only covered every 3 years under the plan. $229 US was claimed for Evan. This was covered at 90%, resulting in $189.18 US being reimbursed and leaving $39.82 US of the eligible expenses to be out of pocket. To make the out-of-pocket costs comparable to what they were in Ontario, Canada Life provides you a letter which we refer to as the excess dental letter. Here, the $39.82 US was converted to $52.92 Canadian. In Ontario, you could have been expected to be out of pocket $40.90 Canadian for the same service. The difference results in an excess dental amount of $12.02 Canadian that can be claimed through your medical team. In order to claim this, you will need a copy of your excess dental letter and a signed general allowance claim. This concludes this module of knowing your U.S. health care for Canadian Armed Forces families about finding and paying for dental care.
To review what you have learned, we will now go over several scenarios. In this first case, we would like to highlight the fact that in a medical emergency, go immediately to the nearest emergency department, or if required, dial 911. There would be no reason to delay treatment in order to find the nearest military treatment facility. If there is an MTF nearby, going there might be a good option depending on the situation, but would not be required. Emergency departments will initiate treatment on arrival and will discuss payment once the medical situation has been stabilized. ERs will allow for direct billing through insurance companies. In this case, you would indicate that you have medical insurance coverage through Allianz Global. If needed, you can indicate that Allianz Global's MD-on payer code is 50749, which may help locate Allianz Global in their system. At this point, you could leave the hospital and expect to receive an explanation of benefits from Allianz Global in the mail within several weeks. The explanation of benefits will state that it is not a bill. It will indicate what the hospital billed the insurance company and what the insurance company paid to them. There may be a portion that was not covered, and there will be a code assigned to this amount indicating why it was not covered. In most cases, the hospital will be satisfied with the amount they receive from the insurance company, as this may have been negotiated between the two parties. In some cases, the portion that was not covered by the insurance may be billed to you by the hospital for the outstanding amount. Any bill for an outstanding amount not covered by Allianz Global can be submitted to TRICARE for payment. You will need to provide your explanation of benefits from Allianz Global, your bill for the outstanding amount, and proof of payment for this amount. If there is any remaining copay or fee that is not covered by Allianz Global or TRICARE, you can submit the remaining portion to CDLS Washington for reimbursement. If a prescription is given and you need to purchase medications, you can take the prescription to a military treatment facility pharmacy and receive this medication or a similar substitute at no cost. If you purchase the medication with cash at a local pharmacy, you can submit this claim through Allianz Global for reimbursement. Prescription costs are reimbursed through Public Service Healthcare Plan at 80%. Crutches could also be something you would claim reimbursement for through Allianz Global as well. If you had gone to a military treatment facility, they may have been provided to you at no initial cost. In this next scenario, we wanted to highlight that in some states the reciprocal healthcare agreement does not pay for the cost of inpatient treatment even though care has been provided at a military treatment facility. In this case, the spouse of a CAF member goes into labor and is taken to the obstetrics triage area at the military treatment facility at MacDill Air Force Base. She is admitted and delivers a healthy baby. At the end of the stay, a few days later, when being discharged home, you receive an invoice for the cost of the inpatient care, totaling $15,000. Ideally, you would have spoken with the patient administration department prior to delivery and provided your Allianz insurance information in order for them to direct bill. If direct billing had not been set up in advance, because of the large amount, you could contact CDLS Washington Health Services Admin and request an advance for the amount of the invoice. This advance, or pay loan, would be deposited directly to your bank account within a few days. At this point, you would pay the bill and submit your paperwork to Allianz Global. This would be a good time to positively enroll your child in the Public Service Healthcare Plan. Finally, you may get an R70 code for an outstanding amount not covered by Allianz, which can be claimed through our office at CDLS Washington. In this case, we presented a scenario in order to remind everyone to become familiar with the Public Service Healthcare Plan. Back in Canada, counseling by psychologists is often not covered under the provincial healthcare. Families with supplemental healthcare insurance in Canada have additional insurance under the Public Service Healthcare to cover additional healthcare expenses such as psychology care. While living in the United States, CAF families have the same entitlements to these supplementary benefits. In this case, the plan would cover 80% reimbursement for each visit to an annual maximum of $2,000 Canadian. This maximum coverage amount would not go very far in this case. This is a good example where combining Allianz Global and TRICARE could allow more coverage than what you would receive under the Public Service Healthcare Plan alone. A referral through TRICARE would allow for continuation of care after the Public Service Healthcare Plan had reached its maximum entitlement. In more complicated scenarios, we would encourage you to contact CDLS Washington to review different options with you and assist in navigating all the options and resources that could be available.
I'm just going to start at the bottom and work my way backwards. So for CAF members in Annapolis, our urgent care options are very limited. Specifically, I've been told that if I have any issue that can't wait until the next appointment, which is 2 weeks out, I have to go to Walter Reed, which is a 90-plus minute drive one way, or a local civilian emergency room. Also, we have been denied MTECs for the drive to Walter Reed, so not only do I have to spend 3 hours fighting DC traffic, yikes, I have to pay for the half tank of gas as well. Do CAF members have permission to use local urgent care facilities through Blue Cross, or is there another solution that is more workable? Is there a plan to reinstate the MTECs for medical travel?
Yeah, that's a good question. I do know DC traffic, and I can empathize with you on that. I'm not familiar with the situation there in Norfolk or Annapolis. Sorry, Annapolis, I guess you said. So I'm going to have to look into that a little bit further, I think. And but I'm glad I'm hearing about this issue because so just to be clear, in an emergency, wherever you are, whoever you are, if you're CAF or a dependent or family of a CAF member, if you do have an emergency, then you just go, anywhere and then contact us and we'll help you sort through it. So whether or not TRICARE pays for it or we pay for it through through either Blue Cross might be one option. We will take care of it. So I would just say for now, let's just agree that in an emergency, go to a nearest facility. Urgent care is usually sort of like a step down from emergency, I understand what you're asking. So in that case, if it's not urgent and you don't need to get to an emergency department, what I would say is to contact us, and then we can just listen to your scenario. And one of the options might be just referring you to civilian urgent care, or we could provide the funding for the MTech. I'm not really familiar beyond that what the situation is, but it's something that our team will look into. I don't know if anyone else on the team would like to chime in, but we'll certainly take that one back with us and come up with a solution for you.
Yeah, I can chime in there. So for the MTechs, unfortunately, the policy is that it's within anything beyond the 50 kilometer, anything beyond the 50 kilometers plus the typical area in which you're allowed to travel for your base it's anything beyond that we're allowed to cover. So I don't think that Annapolis and Walter Reed actually falls beyond that. So the area in which you're allowed to travel plus the 50K. And then for billing in an emergency situation, what happens is they can give you a bill and it'll be the member pays it. And you can request an advance through our office and we'll provide you that advance, and then you can pay it and then submit that receipt for a claim, and then we'll reimburse the claim.
I just wanted to chime in a little bit there too. This is Sean here. We wanted to make sure that we're going to be creating a member specific presentation as well. Today was more driven to really give the most information possible for claims for our families and treatment for our families. So I don't want to confuse matters, and just when you bring up Blue Cross and stuff, it sounds pretty member specific. So I just don't want to confuse the two issues either. So I'm happy to talk offline as well.
Okay, great. Thank you, guys. We have another question coming in from I believe a spouse. The question is, I was under the impression that dependents aren't covered by TRICARE. I have USA insurance through my employer as well. In what order should I file them?
So, Sean here. Dan spoke to this earlier. We're kind of giving the simpler, it doesn't sound simple, but most simple solution, which is basically TRICARE pays last. But the order of insurance, obviously, if a spouse has their own insurance, they would claim through them first, and then they would get an explanation of benefits from that insurer. Afterward, they could claim through Allianz as a secondary insurance through their spouse's health insurance, and then again, they would get an explanation of benefits from there, and there might be something left over at that point, at which point they could go to TRICARE if there's anything left. So the order is you insure yourself, and then you could go to your spouse's insurance, and then TRICARE last.
Perfect. That was an easy one. For therapies such as speech therapy, which has reoccurring sessions, I understand to use Allianz first, then TRICARE. Allianz is maxed out quickly, and TRICARE has a copay per session. I can submit a CF52 for the copay amounts. Is the $100 a max per year?
This kind of insurance under Allianz is it would have been captured on the supplementary portion. So basically, having TRICARE kind of gives us an extra boost that we wouldn't have had back home. But the only amount we can claim through the claims form, unfortunately, is anything up to and including our 70 amount. So the idea of being able to use TRICARE is a kind of a nice to have, so you're not out of pocket as much as you could be. But unfortunately, through the Foreign Service Directives, we can only claim those R70 amounts and those excess dental letters.
Just gonna keep scrolling up here. To whom is the other health insurance submitted? The service provider or TRICARE?
So your other health insurance form is at the military treatment facility at the patient administration. So you'll go there and fill it out and then submit it there, and then that way it'll be on the TRICARE in the TRICARE system.
Okay.
And additionally, it's possible to do it online on the MillConnect website. So if you were to try to get the option of TRICARE online and things like that, you'd have to set up your account with MillConnect, which is challenging, but they do have a help desk. They do make it work, and then they have the option where you can fill in your other health insurance information there as well. I'd recommend doing both at the MTF as well as MillConnect.
I believe this was answered, but just to make sure, does each member receive just one DOD number and the whole family is using this number for filing? And how does TRICARE know Allianz already covered some of the cost?
So for your TRICARE claims, you have your DOD ID number, but on the back of your card or on the front, if it's a DEERS card, you also have what's called a benefits number. The benefits number is a 9-digit number, and then like the member would have a -00 at the end, and then each subsequent dependent would have a different number, so maybe a 01 or a 02. So the root number of the benefits number stays the same, and that's what you claim through. Just the last 2 digits will change. And sorry, what was the second part of that question?
There were 2 sort of separate questions. How does TRICARE know that Allianz already covered some of the cost? Would that be from the previous bill?
When you file, because you're filing in with Allianz first, you'll receive an explanation of benefits from Allianz. So when you submit your claim to TRICARE, you need to include any other insurance. So if the family member has their own insurance through an employer or whatever, so whatever money you've received, basically all the explanations of benefits from each insurance before TRICARE's needs to be included in that claim. That way you avoid claiming the same money twice and committing fraud. So that's basically, and every time you file a second TRICARE, then you'd have one explanation of benefits included with that. If you had 2 or 3 insurance companies before TRICARE, you would include them all before submitting. Does that make sense?
Okay, I was under the impression we were not allowed to utilize TRICARE in Alaska. If that is the case, do we go right from PSHCP to an R70?
Maybe I'll answer that one. So in the past, I think I mentioned this already, but in the past, we were running into some billing issues where people were going to clinics outside of an MTF, and the clinics were billing TRICARE, or the members or the families didn't know any better and just said, you know, my spouse is in the military, I think it's under TRICARE. And the TRICARE would be billed first as opposed to second. So that was the case where the order was incorrect. But if you do it in the proper order, so Allianz first, TRICARE can be billed as a secondary insurer, like we talked about. And that's the same in Alaska. I just know that the NORAD units have been better at hammering that point home to people. And in the past, that's what they were doing, and that's what they were told to do. Over the last few months, we've looked into this issue in quite a bit of depth, and we've determined that we should be using TRICARE for several reasons. One reason, we have an agreement with the United States that says that our families will be covered by the U.S. Department of Defense. So that's in the agreement. We also would be saving a lot of money for the Canadian taxpayers if we used that agreement. And finally, it's an opportunity to get some services beyond what you would get with just the public service healthcare plan alone. And I think we highlighted a couple of scenarios like that. One of the questions had to do with speech language pathology, I think, or occupational therapy. So in the supplementary benefits, you do get capped off at a certain point in the public service healthcare plan. When TRICARE can then kick in, you actually get additional benefits. And we found over the past year that certainly mental health, speech language pathology were two cases where we had people running out of coverage very quickly, and we learned that if we use TRICARE in our billing system, then we get additional benefits for members. So we're really encouraging that. I guess that's new to a lot of people who have been here for several years. But again, we spent a lot of time looking into this subject, and we thought we should brief it the way that we feel it's supposed to be done. So happy to take more questions on that from people. And if anyone on the team would like to add to that.
Yeah, I have a good case study for that, Dan. So we say we run into a situation where you need expensive medications, and those medications are covered at 80% under the public service healthcare plan, up to a catastrophic amount of I think 3,500 Canadian. So you can be out that amount of money by just doing it the old way, where you just claimed it through the public service healthcare plan. But by claiming it through TRICARE Second, in this case, you would go through Express Scripts and file your claim to them. But they'll actually cover some extra. I don't know what the total amount is, but it can save you hundreds, maybe even thousands of dollars by going through TRICARE Second. And sometimes it might be a little bit of a headache, but definitely worth it.
Okay. This sort of dovetails into that a little bit. What happened to the 2015 directive from the Pentagon that states that CAF dependents who receive medical care outside of an MTF for any reason will not be reimbursed by TRICARE? Are you gentlemen familiar with that?
So the direction that came out was more of an oversimplification of how it should be done, and the concern was when things got billed out of order, because often our family members or the member themselves would get a referral outside the MTF and have to go on the economy, and they would get a referral that has TRICARE written right on it. So the provider would bill TRICARE thinking nothing of it. So to drill that into place to make sure that the billing order never got messed up, taking TRICARE out of the mix accomplished that. Families were covered under the 70 amount to be able to claim through the foreign service directives. So it seemed like the simplest way to fix it to not run into families being out of money because they ended up billing in the wrong order. Now we're trying to make it clear, the step-by-step process, to make sure that you don't get caught with that problem. But it was really more of an oversimplification to basically stop anybody to getting into any financial trouble.
Thank you, Sean. Some of the earlier questions have definitely been answered. Oh, Dan, did you want to hop in on that?
Oh, yeah. I just wanted to clarify that the term Pentagon directive, I know what you're referring to. That actually came from our Canadian healthcare health services attaché. So the wording was directed from the Pentagon, but it was actually it was from the health services attaché at the time. And that was going back 5 years ago. So like I said, we did do the research and we looked into it with the intention of providing people the best benefits possible. And so that's the guidance we're giving now, which we do understand is different than what's been given in the past years. But if you follow the directions that we've laid out here, and it is very detailed, and I will just say that all of this information, not only this recorded session, but those modules will be saved to the MFS US website. So if you want to just look at how to do dental, you could just go on and look at the 6-minute dental video. So all that information will be there, and we took a lot of time to go through the details and make sure the details are correct and as simple as possible for people to best understand the system. So I think we've laid out the system in the best possible way for the end users, which is the audience here today, to follow. So please go ahead and use the directions we've given today.
All right, we're going to take 2 last questions. Again, please note that we are going to keep these questions in the chat that we don't get to, but we are getting into an hour and a half now. So we're going to do 2 last ones. The rest of them we will capture. We'll get to the medical team staff, and they will provide some written answers back to us. All right, so our final questions. In the U.S., most anesthetic services are performed by a CRNA. Is there any action being taken to address the issue of Allianz not covering anesthetic expenses when performed by a CRNA instead of a doctor? The service is the same regardless of who performs it. Submitting a claim as well as a memo to Working Group B is a lengthy and time-consuming process. I currently have 2 claims in process awaiting Working Group B approval, 1 since January.
Okay, I'll answer that question quickly. So 2 issues. Yes, that's a great question. Allianz should be aware of that. The Public Service Healthcare should make that change, but that process, it's been raised. I don't know where that's gone. We'll look into it again, but it's a bureaucratic detail that seems to be not getting solved. Having said that, so the system that we have right now that was explained, just to clarify, is that when you go in for surgery, for instance, in Canada you have an anesthesiologist. That's a physician, a doctor who graduates from medical school and then does 5 years or so specialty training in anesthesia. In the United States, they have like technicians or nurses who are trained in the basics of how to anesthetize somebody, and they're looked after under the oversight of an anesthetist. So you might have 6 different surgery suites going at one time, and one anesthesiologist sort of covering all the different techs that are working. So the hospitals can actually bill you the anesthesiologist's code. So if you know you're going in for a surgery, the common one would be delivery of a child. So you're getting anesthesiology done for sure during that time. Ahead of time, you can go and ask specifically for an anesthesiologist to be billed rather than the nurse, which is odd because it's quite a bit more expensive if they bill the doctor. They're happy to do it if you ask them, but generally the anesthesiologist assistant is billed at a lower rate. But if you organize that ahead of time, then everything can be sorted out that way. But we do have a smooth process. I say smooth. I know in your case it sounds like it's been delayed, but we have a letter that a form letter we use because we see this occasionally, I'd say frequently, to help make it go through Working Group B quicker. But your point is taken, and we'll take that back as a team and try to move the issue forward again with the Public Service Healthcare Plan. But yeah, it's a slow process. But I hear your question, and it's a very good question.
So for our last question for tonight, and again, don't worry if your question didn't get answered, we're going to be sending that off to them and they will get us the answers as soon as possible. But for the last question, I think this is an important one to end with because we do have some new families who haven't been here for our prior town halls or meetings who are asking about COVID. So what is the procedure for dealing with COVID care and testing here in the U.S.? For example, if we need testing, how should we go about that? Is rapid testing covered?
A few people have come up to me I've been engaged on that one a couple times, and from what I've heard, for most of the time, MTFs aren't covering it unless you're symptomatic. So getting it done at your MTF is not an option if it's something for like a travel requirement or a school requirement or something like that. So I've been advising to people to go to Allianz to claim that. Basically because TRICARE is not covered anyway, so there's not much point in going to TRICARE second. But to be sure what Allianz is going to cover, it's always best to engage with them. So I can't answer yes or no for sure, but I see no reason why Allianz wouldn't approve that.
Yeah, and I'll just quickly add, I called Allianz specifically to ask that question, and a COVID test is a diagnostic lab test as far as they're concerned. So just like any other diagnostic laboratory tests, you can submit those claims through Allianz, and under the comprehensive coverage that you have, it should be covered 100%. Now, I know there is a range of what those tests cost. So again, if it's an outrageous amount and they compare it to the Ontario cost, then you'd get an R70 code, which you could claim. So it's definitely covered under the comprehensive healthcare in the U.S. There should be no reason why you can't just go to your local testing site and get it done there.
Okay, thank you so much. I'm going to go ahead and stop the recording. Thanks, everyone.